Well, as for the entire state, yesterday DHEC reported 526 new cases with 136 in the upstate. Out of the 6,600 people tested Sunday, at least 8% came back positive. And some good news is that it's estimated that more than 93% of those people with the virus have recovered. Case numbers have stayed in a downward trend for the most part, but there has been some fluctuation. Here to talk with us and about how the South Carolina is dealing with this is Dr. Breannon Traxler with the Department of Health. Doctor, thanks for joining us this morning.
For having me.
Absolutely. Now, the first question is, I know we've seen in the past weeks, we've seen the numbers kind of very inconsistent from day to day. Why do you think that is?
I think a large part of that is just dependent on the week that people are going to get tested. Sometimes if there's larger testing events on a certain day, maybe in a certain location that's very convenient for a lot of people, they'll get tested on that day, and so their results will all be resulted and counted all in one day. So
seem to lose you for a second there, Doctor, but it sounds as though the inconsistent number of people getting tested is something that would lead to the inconsistencies in those numbers each time. But we also have noticed that hundreds of cases are being added to daily case counts after the fact. On both September 2nd and September 10th, we saw more than 800 cases were added and from what was originally reported, and then more than 500 new cases reported on daily case numbers on September 21st. Do you know the reason what's behind these added case numbers after the fact?
Well, some laboratories, as you're aware, have reported large amounts of results to us at the time, and we go back and count these historically on the accurate day to represent truly when someone was tested. But so that can cause the overall numbers to have larger increases or spikes from day to day.
Absolutely. And to that point, we know yesterday we saw 18,000 test results come in from a lab connected to Clemson. Last week, we saw one lab report 15,000 tests, with some dating all the way back to March. Now, are you still having an issue with private labs reporting these cases after the fact or not in a timely manner?
Sure. So by far and away, the majority of labs and facilities are reporting their positive and negative results to us, as required in a timely fashion, within 24 hours of them receiving them. If we continued to have issues with the same lab or facility being delayed in reporting those results to us, we might take some enforcement actions as necessary. But by far and away, remember that the vast majority of our 1.3 million tests that have been performed have been reported in a very timely manner. And so we urge all labs and facilities to continue to do this, and we believe that the vast majority of them are.
Absolutely. And switching gears a little bit now to kind of, I guess, the preventative measures with mask ordinances in place and no plans to shut down anything else. I guess, how can we drive these numbers down more? Sure.
So it comes back down to those same things we've been talking about, honestly, since March, but that we know work. Everyone needs to continue to do that social distancing, avoid larger group gatherings, continue to wear their mask when they're out in public or around people that aren't in their household, and then stay home if they're sick with any illness, whether it be flu or allergy type symptoms. Unless you've been tested for flu and COVID and know that it's not either of those, we really encourage you to stay home because you could be contagious.
Yeah, great tips there, continuing kind of what's been reiterated since the start. Now, we do want to talk contact tracing. In the summer, Dr. Bell said that case numbers were so high that it was extremely hard to contact trace. Where we stand now with the current numbers across our area, is contact tracing still a challenge? Is it any better than it was during the summer?
Sure. So we continue to attempt to make contact with every positive test result, every case, within 24 hours. And we certainly have had a much easier time doing that when there are not as many cases. We have also significantly increased the number of case investigators that we have. We started with 20 that are normally involved in this type of action back before we had our first cases, and we're up to over 700 now. So we're confident that we are contacting people in a timely manner.
Yeah, I know you've been working on increasing those numbers throughout. Now, turning gears towards schools, what are you seeing in terms of the spread in schools? Are things getting better than we've originally thought? How are the spread in schools looking right now?
Sure. So as you may know, we have a dashboard that gets updated. I believe it's once or twice a week with those numbers, and so we have almost 725 cases total, but that's in public and private schools, and it's among students and employees statewide. So I'm not aware of any large outbreaks associated with the school. But that doesn't mean that we need to let our guard down. It just means that all these precautions that everyone's taking are working, and it really means we need to continue to do them.
Absolutely. Now is not the time to let our guard down. Dr. Traxler with the Department of Health, we thank you for joining us this morning. We thank you for all that information.
Thank you.